How much vitamin D are you taking? As a result of a brand new study that is just now being published in Anti-Cancer Research, we have found that the amount that you're going to need to take to reach a serum level to protect from cancer of at least 40 nanograms per milliliter is going to be a lot bigger than we thought. I'm Carol Baggerly with Grassroots Health, and we're helping run this study with our guest, Dr. Cedric Garland here, who is the primary scientist on the study and the designer, actually, of the study itself. Dr. Garland, glad to have you.
Well, thank you for inviting me, Carol.
All right. I would like to know, and I know our audience would like to know, what are the three most important findings that you see in this study so far?
Well, the most stunning one is that in order to achieve the levels of vitamin D in the blood that are needed to prevent cancer, people need to take in considerably more vitamin D than almost anyone imagined before the study was done. And what the study found is that a minimum of 1,000 international units is needed, up to a maximum of even more than about 8,000 units, although we'll call it that. And you can't tell in any individual what the intake should be just by estimation. We found that it's absolutely necessary to get the level in the serum and to keep it in the range from 40 to 60 nanograms per milliliter, which is now universally accepted by the vitamin D community as the safe range for the prevention of a wide range of diseases: breast cancer, bowel cancer, multiple sclerosis, type 1 diabetes, and excessive falls, idiopathic pain, a whole series of things for which there are studies supporting a benefit. So it's going to come as kind of a shock to the medical and nutritional community that we won't be even referring to values that are in the current range of the RDA, which is 600 IU.
Right.
We'll be beginning at 1,000 and working up to 8,000. One last detail on it, too,
Sure.
that I should make clear is that it's now gotten very easy for people to test their vitamin D, because what this study did was to have people test their own vitamin D by making a little pinprick and squeezing the blood onto a blotter, sending the blotter to a laboratory, and then getting the results. We've demonstrated with this study that that method works well for science and probably for individual decision making.
Right. One of the things that you mentioned was that you can't tell what your vitamin D level is without testing. Tell us a little bit about how the test results varied. What's the range of variability?
They were all over the board. We have some people that would be taking low amounts of vitamin D and would have surprisingly high serum 25-OHD levels. On the other hand, there are many people that were taking very high doses, up to 8,000 or more international units a day, that had surprisingly low serum 25-hydroxyvitamin D, which is the measure of vitamin D nutritional status. So the study shows that it's just impossible to estimate it. It would be like trying to determine someone's blood pressure from looking at them. You actually do have to measure it.
I think that's an
cholesterol.
excellent point. You can't tell unless you measure, because the human variability is very great with vitamin D.
Oh, it certainly is, dose for dose. It's just not possible to say. You can get in the ballpark, but not beyond that. But the main point is that we need a lot more vitamin D than anyone imagined before this study was done. The second is that we can't decide on how much vitamin D to take very accurately without measuring the vitamin D level and monitoring it after changes have been made. And the third point is that we want to get everybody up to 40 to 60 nanograms per ml. And just as an aside, we know from the National Health and Nutrition Examination Survey that 90% of people are below 40 nanograms per ml. So the need for measuring vitamin D and raising it is nearly universal in the U.S.
What then is the key thing that you think is important to the scientific and medical community for further action and or research?
Well, I think it's a realization that the levels that are being recommended, even as recently as the December 2010 report of the Institute of Medicine, are far too low to produce benefit. The RDA in the IOM report is around 600 IU, which is a big advance from 200 IU in their previous monograph in 1997, but is well below the level that will produce preventive benefits for colon cancer, breast cancer, multiple sclerosis, type 1 diabetes, and the other outcomes that result from vitamin D deficiency. So what we have to aim for instead is the upper level from the Institute of Medicine, which is the amount that can be safely taken each day,
Right.
and has been determined after 2 years of deliberation to be 4,000 international units a day for people aged 9 and older children and adults. And that's the level that we should be aiming for at age 9 and older. For infants, 1,000 international units in the first 6 months of life, 1,500
And
in the
that helps
second 6
prevent
months
type
of
1
life.
diabetes based on other studies that are out
It
there,
certainly
which
does.
really matters to lots of people.
And it's extremely important because
Yes.
it's a lifelong disease that can almost all be prevented
Right.
by adequate intake of vitamin D by infants and children.
Right.
And by the time the child gets to age 1, the intake should be 2,500 IU a day. By age 3, it should be 3,000 IU a day. And then by age 9, for all the adults, it should be at least 4,000 IU a day.
At
and
least,
almost no
because they
child
should
is
still
getting
have
this.
their vitamin D level tested to see what it's going to
Yes, it
take
should
to
be
get them to that
tested
level.
annually
Right, right.
in every child in the first year of life, and then every February thereafter. And February is the ideal month to measure vitamin D because that's the month in which it gets lowest, and that's where the risk is greatest. Most of the etiology or the cause of breast cancer, bowel cancer, type 1 diabetes, multiple sclerosis occurs during the period when the vitamin D is lowest, and in the Northern Hemisphere that's in March.
You mentioned in the study we found that people needed to take a lot more vitamin D to get to these higher levels. Was there observed in the study any examples of any adverse events or toxic effects?
No, in this study, which was for a brief period of time, but nonetheless looked at people who were taking up to 10,000 international units a day,
Right.
we did not see any evidence that there was a trend toward an increase in risk of the normal concerns that go with vitamin D overdosage. So it doesn't appear that in the range needed for prevention of cancer and other diseases that there is a risk so far.
That is really good news. And it's good news on many fronts because there's such a large group of people in the study. But secondly, even with the Institute of Medicine report, they talked about the no adverse event level being 10,000 IU. And that is certainly what we observed. But we observed it in practice and not just in thinking about it. So that's
yes,
great.
And it's in a way a good sign that the Institute of Medicine anticipated the findings of this study when they discussed it and came up with the conclusion that there were no adverse health effects associated with intakes up to 10,000 IU a day. And this study really puts the confirmatory stamp on that assertion from the IOMs.
Where else are we going to go with this study?
Well, the
we've got
next
a lot of
step will be
data
to have a longer period of follow-up
Yes.
to help confirm that there are no adverse effects, and ultimately long enough to begin to confirm benefits that are anticipated from nearly 100 prior studies that have not looked at people who are taking in this level of intake in the range from 1,000 to 8,000 or so IU a day. That expanding the number of people to increase statistical power, expanding to other countries, other cultures, and other demographic subgroups within the United States, which will increase the generalizability of the findings.
Right. The article is published in the Anti-Cancer Research Journal, correct?
Yes.
And its date of publication is February the 20th, 2011. Are you going to have a party?
I think we should. Pity not to recognize it because it will be a watershed moment
It is.
in the
It is a
field of
fantastic
choosing
study.
the amounts of vitamin D that are needed to prevent illness.
Thank you.
My
very much.
pleasure.
All right.